Some hospitals in Metro Atlanta are seeing a worst case scenario.
New at 5, Latasha Gibbons tells us one major healthcare system is expected to open its second temporary facility to house patients.
The Northeast Georgia health system reaches a new high. Today, they report having 221 people in critical care beds, forcing them to use yet another facility to treat sick patients.
We're very full in our hospital beds and our critical care beds.
For the second time in 7 months, the Northeast Georgia health system is having to add another facility to house hospital beds for critical care patients.
Today, we had 221. In the hospital. We're running really close to in between 95 and 98% capacity all the time now.
Dr. John Delzell says those numbers include COVID-19 and non-COVID patients, but are mostly for those being treated for the coronavirus.
During the first wave, we really spent a lot of time expanding our critical care capacity. We opened up a couple of new ICU areas in our hospital.
Early next week, they're preparing to open a wing at Laurel Woods Mental Health Facility in Gainesville, giving them at least another 20 beds.
So it's a large open area that we're able to put more beds into to staff as a more lower acuity place.
And with anticipation of more beds comes more strain on already exhausted medical professionals.
I think we've been struggling, particularly as more people have gotten sick. That has made it more of a challenge because our staff gets sick too. And so then, that just makes it more of a challenge.
Delzell says people's individual choices for the holidays could make things better or worse.
We really want people to think about, we're coming into the holidays. We want people to think about gatherings. Don't go to other places. Don't go to holiday parties. That's a disaster waiting to happen really in our area. We're already at capacity. So if people start to, have Christmas parties or New Year's parties, that could really make things worse.
And Gainesville isn't the only place where hospitals are near capacity. Georgia has 14 hospital regions, and right now, 6 of them are stretched so thin, they're looking for other places to start housing patients.